Hi, I'm Dr. Khurrum Shaukat Yusafzai, Hyperbaric Medical Consultant. Today's video is about history of hyperbaric medicine. So let's begin. Hyperbaric medicine developed as deep sea medicine because of the endeavors of diving, and the development of diving equipment enabled the man to dive deeper than 30 meters. And under the pressure of the sea, the man developed decompression sickness. And to treat the decompression sickness, the first hyperbaric chamber was made. And the same hyperbaric chamber treats about 300 diseases. The ancient history of hyperbaric medicine started in the 4500 BC, and the pearl divers in the Indian Ocean would dive at the great depth to bring the pearls to the surface to enable riches. These pearl divers, diving since 4500 BC, would dive under the sea and were known as skin divers. The skin divers in the early recorded history were diving multiple times, but they would not develop any decompression sickness, hence no need of treatment. It all changed in the 320 BC when the first man developed decompression sickness. His name was Alexander the Great. He was lowered in a glass barrel to the depths of more than 30 meters to see the defenses of the city of Tyre near the present day Lebanon in the Middle East. So when he came up, he had decompression sickness. In order to treat that, he had two great men, Plato and Aristotle. The modern history of hyperbaric medicine started in the year 1500 AD. Leonardo da Vinci, the famous painter who drew the 12 disciples of Jesus Christ, also had a diary. In his diary, there were many inventions that were far ahead of its time, like the aeroplane, helicopter, the hyperbaric chamber, and also the diving suit. Leonardo da Vinci special diary with all these inventions and the diving suit and the hyperbaric chamber is a subject and a mystery of the early history. This hyperbaric suit resembles the modern diving suit, rather the rebreathing suit. In 1620, Cornelius Trebel invented the first diving bell. It was a bell-shaped structure, and the man would ride into the depths of sea in this diving bell. the exploration of the depths of the sea had started. The diving bell will remain inside the depths of the ocean till the air inside becomes stale with the high carbon dioxide content. There was no way to replenish the stale air. Another variation of the diving bell was the diving barrel, where many men could dive at the depth of the ocean and look for the riches at the bottom. In 1630s, Edmund Halley of the Halley Comet's fame had great interest in the diving bell, and he improved the diving bell by replenishing the inside air of the inverted bell by means of drums bringing in the fresh air. These drums would bring the fresh air which would be emptied inside the bell, and hence the diving bell will remain under the ocean for up to 2.5 hours. This enabled long time work to be done at the depths of ocean, and many construction projects were completed at that time. The diving bell of Edmund Halley could be seen in the modern museums. The diving bell became subject of the folklore. The diving bell stimulated the imagination of man, and its shape was changed progressively, and many submersible vehicles were invented based on the structure of the diving bell. These submersible vehicles enable the sea to be explored. Some of the vehicles had long arms and contraptions attached to it. But at that time, the submersible vehicles would have only one man or maybe two inside. The submersible vehicles were used to get the riches from the depths of ocean. These riches were the reason that exploration of the sea was sought. Sunken treasures and gold. In 1833, the French Carmagnole invented the first diving suit. This diving suit was made up of iron and was heavy, about 400 pounds. This heavy iron suit was enough for the man to explore the depths of the ocean, and many different designs of the diving suits were seen across the Europe. The Ksybiz company had a lot of diving suits and diving apparatus in the Britain. helmet had small holes for the eyes, but the mobility was really limited. Man, with his interest and curiosity, was started to conquer the ocean, and during the conquest, the decompression sickness was observed more and more, and the interest in hyperbaric medicine developed more and more. Later on, fabric diving suits were made, and only a metallic helmet was used made up of aluminum, which made it lightweight and more easier for the diver. And the glass porthole in the helmet also became bigger. This type of diving suits are still used even today, also known as the Mark IV diving suit, which is still existing in the inventory of American Navy. Some of the diving suits still had the metallic part to enable diving to a very great depths. The diving suit would be lowered through a crane from a ship anchored in the ocean. These diving suits are sometimes used even today. In 1865 and 70, the Rebreathers also came into being. Instead of releasing all the oxygen into the ocean as exhaled air, as some percentage of it would be absorbed by the body, the Rebreathers is a closed circuit diving apparatus where the air which is exhaled is used again to use the oxygen. So the diving equipment would become lighter in weight. A tank was seen attached, and also the wires coming from the surface still existed. The rebreather allowed diving at the depths for a longer time as compared to the open circuit diving apparatus. Then the scuba diving apparatus, meaning self-contained underwater breathing apparatus, invented by Jacques Cousteau of France, came into being, which ushered in the era of modern deep-sea diving. There was a greater freedom and no need of attached pipes for the air and oxygen. This scuba diving apparatus has revolutionized the deep sea diving. From the 1662, the modern history of the hyperbaric medicine also began. Dr. Eugene Bourdon wrote the first book on hyperbaric medicine in 1868. Fontaine built the first operation theatre inside of hyperbaric chamber, and in 1917 the first commercial hyperbaric chamber was built by Traeger, and in 1928 the world's biggest hyperbaric chamber was made. But the first hyperbaric chamber was domicilium, made in Britain. The 1877 Fontaine hyperbaric chamber had an operation room inside the hyperbaric chamber for the patient to be operated. The improvement in patient condition was observed. In 1833 to 1866, Dr. Paul Burt developed hyperbaric medicine for high altitude sickness for people going to high mountains and in the aeroplanes. Dr. Paul Burt hyperbaric chambers was actually donated and gifted by his friend, another doctor who is very famous for high altitude studies by using the hyperbaric chamber. Both of these friends developed the hyperbaric medicine even further. His hyperbaric chamber would be hyperbaric as well as hypobaric. His friend name was Dr. Dennis Jordani. Both used the hyperbaric chambers, sometimes together, sometimes separately. Jordani was a wealthy physician and he could afford the hyperbaric chambers. He was also the one to give Dr. Paul Burt some of his hyperbaric chambers. These hyperbaric chambers will also decompress, or hypobaric chamber as they are known. So they would do hyperbaric as well as hypobaric environment. In 1917, the first commercial 2-atmosphere hyperbaric chamber was made, known as Traeger, and it was marketed for sale to the general public. In 1928, Dr. Cunningham built the world's largest hyperbaric chamber with 38 rooms. He used it during the Spanish flu pandemic to treat a lot of patients. But when the Great Depression came in 1937, he died. So when he died in 1937, the chambers was scrapped and sold during the Second World War to make weapons. In 1956, Dr. Buremia also performed operations inside the hyperbaric chamber in Europe. These chambers were very successful. They demonstrated that without blood, surgery could be performed and the patient would not die. So he performed these operations between 1956 to 63 in the country of Netherlands. They also demonstrated that gas gangrene could also be treated by hyperbaric medicine. The first international hyperbaric conference was also held in Amsterdam in Netherlands, and the doctors from all over the world came and they participated. In the 1965, in the United States of America, Dr. Saltzman in the Duke University also used hyperbaric chamber for many experiments. And few years later, because of the advancement in USA and Europe, the Undersea Medical Society came into being, which is now known as UHMS. In the first meeting, there were 88 members in 1967. The progress and the experiments with the hyperbaric chamber continued. Multiple sclerosis was demonstrated in Czechoslovakia, and in 1971, sudden deafness was proved to be treated, and 73, the mortality was shown to be reduced in myocardial infarction. In the current status of hyperbaric medicine, there is a textbook of hyperbaric medicine now having its 5th edition. Many reference books also exist. There is a second textbook of hyperbaric medicine which is called the Textbook of Diving Medicine with the 4th edition. The reference books like the Oxygen Revolution and the Indications of Hyperbaric Medicine, the Medical Practice, and so many other interesting books exist by many authors. About 100 reference books exist. There are reference books for nurses and for health and safety technicians as well. And the hyperbaric medicine has now expanded so much that millions of research articles exist in the database in the universities all around the world. All around the world, many modern hyperbaric facilities are existing. These hyperbaric facilities are about 5,000 in the whole world. The highest amount of hyperbaric multiplex facilities are in China, 1800, 37% of the world. Then second comes Russia, 1300 chambers, or about 26%. Then in Europe, about 10% or 500. Then in Japan, about 10% or 500. In South Korea, 8% or 400. In USA, only 7% of the world or 350 chamber exists. In the rest of the world, it is only 2% or just 100 multiplex chambers. The hyperbaric medical societies exist all over the world in the different continents. Like in Americas, the UHMS, the Underwater Hyperbaric Medical Society. In the Europe, is the European Underwater Baromedical Society, EUBS. In the South Pacific, it's called SPUMS, South Pacific Undersea Medical Society. And in the continent of Asia, it's AHDMA, Asian Hyperbaric and Diving Medical Association. In conclusion, the 500 years of modern hyperbaric medicine history and the thousands of years of ancient hyperbaric history has developed a new specialty of medicine that is treating 300 plus diseases which was not possible before. And this specialty will go a long way to treat many more diseases. I hope you have enjoyed the wonderful video. To ask me any question, please contact me on the social media apps scrolling down below. And I hope to see you again. So please subscribe to my channel and press the bell icon. Bye and take care.